Thanks very much, Scott, and thanks all of you for this opportunity to talk to you about this very important public health issue. My name is Bryan Liang, and I'm actually on the board of the Partnership for Safe Medicines, but I'm also a physician at the University of California, San Diego. I'm also a health economist, as well as I have my JD, and I'm at California Western School of Law. I'm going to try to provide a little bit of an overview about this particular topic. Then you're going to hear about you're going to hear from the heroes, the people who are the regulators who are fighting this fight. So without further ado, let me just get going here. First, let's just talk about online pharmacies and see what happens. You can just thanks. Online pharmacies. This is just not a singular thing. Why do we have online pharmacies? Because of the explosion of the internet. This is what has created intense amounts of crime, intense amounts of vulnerability. Billions of people look on the internet, billions of people deal with the internet, but specifically on health, millions and millions and millions of people use the internet to access healthcare information. They search for stuff, and importantly, they buy and buy and buy drugs online. Over and over and over again, they buy these drugs. And $11 billion, that's a supposed estimate, a realistic estimate. That's baloney. When you're talking about $11 billion, triple, quadruple, make it 5, 10, 20 times bigger, because this doesn't count the illicit activity. So in fact, that's what we're interested in. So we really have to understand that this creates tremendous problems, and it has already created a tremendous market. And obviously the three major things that occur because of this with respect to safety are, first, drug safety. That's a big problem because these drugs aren't exactly what they say they are. It's patient safety, obviously, tremendous risks to patient safety, and other kinds of problems, security issues and other concerns, social concerns that also bleed into this particular area. So let's look at each of these seriatim. Next slide. First, of course, drug safety. Everyone, anyone with an internet connection can access this stuff, literally. Your 5-year-old kid, all the way up to the people who are buying this stuff for life-saving purposes. The problem is as dangerous as anything. You don't know what is in that black box. And you can see right here in that center, those center pictures, those are people who are making the drugs. They're sending them over the internet. That's what this stuff is. Now, there's a reason why they cost millions and millions and millions of dollars, up to billions of dollars, to learn how to make these drugs. They have to be done in highly technical circumstances, very, very tight manufacturing practices. And unfortunately, obviously, that's not happening here. Unfortunately, as well, this is a big black box, because as soon as you get it, if you're ordering it online, it's the form. You can't tell the difference. Not even the experts can tell the difference. Now, I come from Southern California. Form is everything for us. So, in fact, what we see is in this whole concept of we just need to make it look good. If you make it look good, someone will buy it. And you know what? They're right. These criminals are absolutely right. You make it look like the drug, and people come flocking to it. It's a real big problem for us because of the fact that there is this big open thing, and in fact, you can't tell the difference. You can't tell the difference between good or bad. Kind of next slide. Now, this is not a theoretical issue. People have died because of this. You know, we see Marsha Bergeron, Ryan Haidt, my own community. I know Fran. I know her family. I know these people. This is not something, if you know and ever been experienced with somebody who has lost their child. You know, Ryan, straight A student on his way to Stanford, on a tennis scholarship, and now he's dead. Now, this is just something, it's not, you know, I don't care about the IP rights. I don't care about the whole concept of, you know, who's making money off this. All I care about is crime. It's crime. It's a public health issue. You've got to address it. These people who are doing this are actually targeting the most vulnerable patient populations there are out there. In fact, in these circumstances, not only are they targeting these patient populations, the people themselves don't realize by buying this stuff and not having professional oversight, they're killing themselves. They don't know. They have a right to have access to information about the right way of doing this. This whole online pharmacies on the illicit level, which I consider to be drug pushing, this is just creating situations where dangerous behavior is going to continue and compound on itself. And this exactly is what is happening. Next slide, please. And you can see here, they're very seductive about it. You know, this is really, really friendly, really beautifully looking marketing, nice, really wonderful looking people, clean cut, you know, kind of, the phenomenon is, in the medical literature is known as looks like us. You know, this is a trusted person because it looks like us. You know, this is not somebody who's, you know, this nefarious person in an alleyway. Really does look trustworthy. And look who they're targeting. You know, the senior population, adolescents obviously, but also uninsured, underinsured, people who can't access traditional sources of legitimate product. And unfortunately, they take advantage of this. You know, oh, it's generic, it's Canadian, don't worry about it, it's just as good, it's just as good. Well, unfortunately, the people who they're targeting don't know, and they don't have that educational foundation to understand that this is dangerous. And unfortunately, they're making their money off of these very people, and these are the very people that need to be protected the most. Next slide, please. Now, you can tell here that there's a tremendous amount of misleading marketing that fuels this industry. No prescription, obviously, big, huge issue. Obviously, we know about that. A lot of this stuff happens, unfortunately. As well, the generic and Canadian concepts. Sometimes these people illicitly use social media sites. Unfortunately, you just can't police everything, and they just filter in every little point that they can find. And remember, these people don't have to follow the law or the rules, so they don't care. Those of us who try to follow the rules and do the right thing, we're constrained and we feel constrained ethically. These people have no ethics. They're just concerned about making a buck, and they will find any way they can to move into these areas. And unfortunately for some of us, trying to keep up with this, we're panting behind. We follow the rules, they don't. Have the next slide, please. Now, unfortunately, not only is it a patient safety issue, not only is it a drug safety issue, it's also a societal issue, because these people are also stealing your financial information. They're ripping you off. And as well, unfortunately, from my own perspective, particularly for the senior population, this is elder abuse. They are financially ripping off some of the most vulnerable patient populations out there, including seniors who are on fixed incomes, who, in fact, if you did this, for example, in California, and you were caught, we can throw you in jail for 25 years because we recognize that it is such a vulnerable patient population. These are the very targets that these guys are going after. As well, of course, if you put privacy information in there, for example, medical information in their supposed healthcare screening forms, that stuff is not going to, they're certainly not interested in your privacy or your confidentiality of your information. They're simply interested in getting that information and, unfortunately, in some cases, selling that information. And of course, finally, this is not just one person ripping off one person. This is a creation we're seeing of criminal networks, terrorism support, all of these negative things that society is going to pay the price for until and unless we get this under control. And next slide, please. As you can see, this is a website, the Partnership for Safe Medicine's website. And you can see this is a global problem. And unfortunately, the internet has no borders, and neither does this crime. Online pharmacies are problematic everywhere, every country. You can see these dots, and this is just one little thing. This is like a year ago. Add about 20, 30, 50 more of those little pins, and that's just what we know about. That's not even actually all the incidences. Unfortunately, because it's a global problem, we need a global governance solution, and alas, right now we don't have one. We don't have global governance treaties. We don't have a really working top-level UN, for example, activities to try to get at this problem so we have a sense of what is happening and then subsequently a standardized way of approaching it. As well, fueling this is open markets. Now the world's a globalized place. Drugs pass through dozens of countries, hundreds of hands sometimes. They go into free trade zones, big black boxes. We don't know what comes out of there after they've gone in. Who knows? So this globalization has also created tremendous challenges for us to try and, in fact, address this problem. Next slide, please. All right, now, some of the big problems, just to filter it down, websites. The technology now allows us to actually create websites, get up and get down, totally anonymously. I have an 11-year-old nephew. He showed me last weekend how he could actually create a website. He showed me how he did it. He created a website in an hour. He took it down in 5 minutes. And you could not tell who did the website. He is an 11-year-old. These people, I'm an old guy, but I have a little knowledge, and he is an incredibly smart kid, but an 11-year-old can do this. Think of what focus groups of criminals can do with that information, how they can do this. They are much more sophisticated, and we're trying to catch up. As well, of course, enforcement challenges, global problem, but generally, enforcement is based on sovereignty. So national sovereignty, state sovereignty. So law enforcement is really constrained by the fact that they have to limit themselves to their own borders. Very difficult to get global cooperation on this very tough issue. As well, there's a lot of causation issues. All of those things make it very difficult for our best law enforcement people to go out there and do something about this because they're just simply constrained by law. As well, on the state level and other levels, we don't have enough attention to this. We don't, again, have the same kind of coordination we need across states to really get at this problem, because you squeeze the balloon in one place, it just opens up in another. And that's what we're seeing here as well. We don't have a very good focus yet on trying to come up with, say, a national organization that really comes out with, say, a standard set of model rules that help us. Unfortunately, we're still in the process of learning about this. Well, during this whole process of learning about it, the criminals are going further and further and further. Again, we follow the rules. They don't. They don't have to issue annual reports. They have no accountability. That gives them a big advantage. Next slide, please. Now, I just want to give an example of some of the problems here. You can see over here, this is the supply chain. You can see what can happen here, how things can go outside of our system. And just give, for an example, an online drug seller makes a drug available. This is obviously a illicit person, a drug pusher. Consumer actually purchased that online. Let's say that there is actually some inspection. Unfortunately, customs, again, they're constrained by the number of packages that are coming through and the economic resources they have. So according to published figures, they're inspecting less than 1%. When you're talking about 130 million packages a year with drugs in them, that's an estimate. That's still a lot of packages. Now, they pull it aside and say, FDA, please inspect this. Unfortunately, one of two things can happen. One, FDA is also overwhelmed, and they can't get at all those packages. So if it doesn't go within 24 hours, roughly, it's got to be sent on by international postal regulations. Similarly, though, if FDA does inspect the packages, they are required, again, under international postal regulations, to be able to have to give the recipient the opportunity to say, I'm challenging you, that is legitimately mine. I'm legitimately entitled to that. Now, of course, no one's coming up and going to do that. So what they end up doing is, again, under U.S. postal regulations and as well as international treaties, they must send the product back to the sender. Well, the sender's jumping for joy. They get to sell it again. So unfortunately, again, notice we have an international treaty for postal regulation that actually impedes us. Unfortunately, we don't have an international treaty how we address illicit drugs, online pharmacy ordered drugs through the mails. Next slide, please. And as you can see here, there's a lot of people who actually somehow support these online drug sellers. Unfortunately, some of these people are doing it right. Some of these people are actually legal entities. Others are illicit. Let's just talk about these briefly. Next slide, please. You can see here the illegal manufacturers. These are people who are making the counterfeit drugs, making the stuff that is being sold. China, India, the big offenders here. Facilitators, these are some of the people that actually source the drug for these websites, get them to the websites to get then subsequently get sold. And then we have service providers. Now, most of these are actually legal. But again, they can't police everybody. They can't see everybody. They can't work on everybody. So unfortunately, for example, the search engines, they actually have a legitimate and illegitimate, but how do you differentiate between, in terms of organic searches? How do you know which ones are actually lying to you and which ones are not when you're trying to sell them advertising space? Same thing with logistic providers, people who are the freight carriers. How do you know if it's listed or not? How do you know these people are actually selling drugs illegally? Very difficult to tell. Payment processors, same deal. How do you know you should execute a particular financial transaction? How do you know you shouldn't? Again, very tough to know because we don't have a good feel on the landscape of this problem. Next slide, please. As well, ISPs, domain registers, same issue. Tremendous challenges in determining who's doing what legally, who's not doing what legally, and it's all muddied by international, the globalization of the drug supply, globalization of these rules. As well, other data aggregators, very difficult to tell, for example, some of these listservs that will actually expressly tell you where can you buy drugs, and they won't find out without a prescription. Literally, they come up, they go down. They pop up other places, they come down. So really hard, again, to try to police all of this in a circumstance where it's a global market, public and private groups are involved, really, really tough. Next slide, please. Now, obviously, I'm trying to point out that this is a global problem. And it's a multifaceted problem, so we need a global solution and a multifaceted solution. We need people to work together. The heroes right here, NABP, FDA, hopefully you can also say maybe the Partnership for Safe Medicines, all of these people who are on this list, as well as more, are trying to get at this. But it's very important that these groups take advantage of the potential for public-private partnerships.